What's going on, everyone? Welcome to today's pandemic update for Wednesday, May 17th, 2023. Hopefully everyone's staying safe. If you had to take a COVID test in the last 24 hours, hopefully you have tested negative. Alright, normally we would start off with India's numbers, but I do not have India's numbers from any of the India news sources. So therefore, we're going to start off with this instead. This is some bad news. I'll tell you, by the time you're done seeing this video, you'll want to rethink how you do your day-to-day activities if you're living in belief that the pandemic's over. The pandemic is nowhere near over, and we got a lot of proof that proves that today. Verified COVID-19 infection increases the diabetes risk. We have seen study after study that say this and suggest this, and here's yet another one. This one I did tweet out. It says results also suggest the diabetes risk persists across COVID-19 variants, and that upfront vaccination may help to reduce the risk of post-infection diabetes. So it does show here why it's very important to get vaccinated. All right, this is up in Canada. I believe this is in British Columbia, Western Canada. Third COVID-19 outbreak in 3 weeks declared at Barnaby Hospital. Why? Because the number of COVID infections has climbed yet again. All right, switching gears for a little bit over to H5N1 news. England has reported 2 cases of H5N1 at a poultry farm. And no, these are not in animals, or in birds, I should say. These are 2 people have tested positive for bird flu infection at the farm in England. It does say here, it sounds like their cases are asymptomatic. It says neither worker has suffered symptoms of infection and both cases were found during screening. So we'll have to see if they had any contact with anyone or if they developed symptoms down the line, but so far, no symptoms in these cases. Speaking of bird flu, we move on to this. The U.S. authorizes emergency use of bird flu vaccine to save the critically endangered California condor. Remember we were talking about this in our H5N1 video a few weeks ago, how the condors are suffering H5N1 really bad? And that continues to be the case. At least 21 have recently died of H5N1, or nearly 4% of the total population. And it says here the photo that BNO used is of a California condor chick which hatched in Arizona last week after its mother died of H5N1 bird flu. Alrighty, moving on to our next story. This one's not good either. 1 baby dies and 8 are left in intensive care after being struck down in unusual cluster of usually harmless infections. Gee, can anyone tell me why they potentially did that? Maybe the mother, before they were born, had COVID. Maybe the baby had COVID. Maybe the baby or the child was born with a weakened immune system because the mother had a COVID infection during birth. It's just speculation. Maybe that's not the case. Maybe this really is a mysterious outbreak. We don't know. But yet again, another case of something unusual happening. Moving on, we got more news. It says 48 hours of sick time will soon be Minnesota law. I guess in a sense this is good news, but a lot of the comments I've been reading in relation to this, or the reaction I should say, a lot of people are saying that's not good enough, but I'll put it to you this way. At least it's a start. It's better than nothing at all, right? So at least it's a start, and maybe they can build upon it from there. Maybe down the line, they can increase that to 72 hours, then 4 days, 5 days, whatever the case may be. Moving on to our next story here, and this is really concerning. Yet again, we're going back to England again, across the other side of the Atlantic. Heart care waiting list rises by 63% in 3 years in England. What happened 3 years ago? Does anybody remember what happened 3 years ago? I know. The COVID pandemic started. And we know post-COVID heart conditions is a real issue. Some people have died of heart attacks while being positive for COVID. Well, let's read a little bit of this. Latest NHS England figures published today show that the number of people on cardiac waiting list has risen to a record high of 380,787 at the end of March 2023, an increase of nearly 8,000 people since last month. So that number continues to get worse. Put two and two together. A large reason for this is the COVID pandemic, which is continuing to be ongoing. Now we move on to this. Remember the Giro d'Italia, the bike race or bike tournament that's going on over, I believe it's in India. Excuse me, Italy, not India, in Italy. And we've had a few cases of it. Now there's 4 more cyclist athletes that have tested positive for COVID. And it sounds like masks are being required again at this event, which it should be because this event is going horribly wrong. Moving on to this now, and this is a thread that I did today. 2 cases of measles have been confirmed in Tokyo. Remember we reported that there was a case of measles reported in Maine? Yeah, I added that to the thread too. And along with this, new cases of measles are popping up in England. There's a measles outbreak in American Samoa, and it's so bad they had to declare a public emergency for it. Yeah, that's really bad. Then you come down here to the Maine child who tested positive for measles. They're saying he wasn't infectious, or they weren't infectious. And finally, once again, measles cases on the rise in England, say public health experts, and I did quote something in here. Measles was considered to be eliminated in the UK in 2016 to 2017, meaning transmission had stopped. But by 2018, which is before the pandemic, it was spreading once more, and there were 880 confirmed cases in 2019. And obviously it doesn't show it here, but we know that there are more cases as of recently that are popping up with proof from the article up above. And now we have this to report as well. Bassist John Giblin has died at 71 years old. So yet again, another entertainer. It seems to me that we are losing a ton of entertainers. And it doesn't stop there. We do have one more. A comedian, Andy Smart, has suddenly died. We don't have either of these deaths. We don't have a cause of death listed. At least I haven't seen it yet. Maybe there's been an update since I got all this put together on my screen. But he died unexpectedly at 63 years old. Folks, 63 years old is not all that old. And that's 2 entertainers in one day. I mean, entertainment, it's not going to be around much longer if we keep losing entertainers at this rate. We have lost so many already this year. I mean, if I was to do a memorial video with music and showing a list of names, it would already be over 10 minutes, and it's only May. I mean, wake up. Things are not going normal whatsoever. Walgreens, we had that update on Monday. 25.4% is the national positivity. All right, this day in COVID history, COVID pandemic history. May 17th, 2021, an estimated 5.1 million women left the workforce when COVID-19 closed schools and child care centers in 2020. Today, 1.3 million remain out of the workforce, and only 56% of women in the U.S. are working for a salary, the lowest percentage since 1986. Ooh, that was a horrible day in COVID history. Taking a look at wastewater, no update here, still flat in all regions. Not much to report on this national CDC map. The individual sites are pretty much the same. We'll do our next weekly update on that. I believe that's going to be on Sundays. That seems to be the day that works for doing that, and at that point we do have a new refresh of data from most of the wastewater sites. Some of them tend not to update. All right, the latest variants are XBB.1.5, 64%, XBB.1.16, 14.3%, XBB.1.91, 9.2%, XBB.1.92, 4%, XBB.2.3, 3.5%, XBB.1.51, 2.4%, and FD.2 is at 1.8%. New Jersey. New confirmed cases, 115. New probable cases, 125. Pandemic's not over in New Jersey. They also reported some deaths today. 2 lab-confirmed deaths, and 4 hospital reported deaths. If all are separate, that is 6 more deaths in New Jersey today. And let's take a look at their hospitalizations real quickly. Hospitalizations, for the time being, in New Jersey are dropping. 172 hospitalized, 7 people on the ventilator, and 27 people in the ICU. All right, Philadelphia. Yesterday was a very busy day once again in Philadelphia for ambulance calls. 777 incidents yesterday. And that does kind of fit with something I'm going to be showing you tomorrow. We have a special video tomorrow that may potentially become a weekly series. Stay tuned for that. Moving on to New York State. We do have some bad news to report in New York State. First off, 535 cases in the last 24 hours. That does not include reinfections or at-home tests. I think it's safe to say New York State is missing a lot of cases. Test positivity, 1.6%. Average 7-day average is 1.8%. Now we come to the bad news. Let's go with statewide first, and we are going to zoom this in. Let's zoom this in, shall we? And here we go. You can see New York State. It's not dropping anymore. 575 people in the hospital, 60 people in the ICU. Now let's go down to New York City, where we do have some problems with New York City. Look at this. Not only has it stopped dropping, it's starting to rise again. So we are seeing a rise in hospitalizations in New York City. 214 people are in the hospital, 26 people in the ICU. That is higher than yesterday's 203. Now, I'll be fair. That is not a, whoa, it's rapidly rising, but you got to start somewhere, and it has started. Let's take a look at hospital admissions, because they are starting to rise as well. And right now, yesterday, or, well, the previous day was 93. Today is 46 admissions. That's higher where they left off on the 12th to end last week at 38. So admissions are rising in New York City as well. Again, it's not a rapid rise, but again, it starts off from the bottom, and we know it works its way up higher. Chances are this is XBB 116 and the XBB 2.3 variant. Alrighty, moving on. It is Wednesday, which means we get an update out of Texas. It looks like new confirmed and probable cases are at 4,500 this week. I know it's showing here that it's down from last week, but then you come down here and it says it's up from last week. I don't know why they're using the language such in a confusing way. It's just another way of trying to hide how bad things really are. At least that's my assumption. 43 fatalities reported this week. That is down, and this is good. It is down from last week's 56, but again, it's another 43. It's 43 too many. Moving on to the international update today. South Korea cases are up 14%. Deaths are up 47%. Brazil cases are starting to rise again. 73% increase, 8% increase on deaths. Then we come down to Canada. And I know I have some Canadian friends that watch this channel. I have some Canadian friends on Twitter. Maybe you can enlighten to me as to why there is such a big increase in Canada. My assumption is a backlog has just been posted for both cases and deaths. 24,242 cases versus 3,821. That works out to a 534% increase. They also had a 475% increase on deaths as well. 46 versus 8. Coming down here, we have more places that are rising. 25% increase in cases in the Philippines. They did not report deaths this week. 13% increase in cases in Malaysia. 125% increase in deaths, 18 versus 8. India, cases down 55%, and deaths down 48%. Continuing on down here, Thailand cases are up 39%, deaths are up 120%. Then you come down here to Chile. 31% increase in cases. They did not report their deaths. Colombia, cases are up 17%. Deaths are down 44%. Panama, cases are up 11%. Deaths are 1 versus 0 reported deaths last week. And we'll end today on Bolivia, where cases are up 3%. They did not report any deaths for this week. Alrighty, folks, that does it for today's pandemic update. I know we crammed a ton of information into our 15-minute window. I would like to thank everyone for watching. If you like this video, give it a thumbs up. If you want to see more content like this, hit subscribe down below. Until I see you again next time, stay safe, everyone.